Okay, this is like just to highlight that when I was in UM before I joined, I conducted the program. We bring this test ROSE, from you've heard of ROSE, lead by Prof. Win Ling. We bring this into the orang asli community. This is just to highlight to you all that okay, sometimes you feel you will get patients yang betul ke ni, boleh ke buat apa semua. Actually, we went to this orang asli with maybe more than 24 hours jalan masuk guna. I join my brother in Merak. Dia ada banyak program lain tapi kita join, bring the sample and buka booth sikit, alright. Buat just dekat balik langsir of this surau, dekat post one of the big kampung lah, dia ada post. Yang sini tak silap dekat pos Bala if not mistaken. So this is the first lady dah yang berjaya yang buat, and we get 20, just a small half a day macam tu punya program. We managed to get 20 samples. The challenge in among orang asli community is actually many of their multipara is less than 30 years old. Okay, so that's another problem because this rules, because sponsored by Etika, so only for those 30 and above. So I pun kat sana line pun tak ada, pasal nak contact balik Prof Wu, nak just tanya, they have para 4, para 5, umur tengok 28, 27, so it's not eligible in that. So I can get more actually, if I can get earlier. The eligibility criteria tu is being reduced because maybe in orang asli the situation different. Another challenges is actually ada yang juga yang the kad pengenalan, we can query, whether betul ke tak dia punya tarikh lahir tu. She might actually more than 30, so we don't know. That's a second challenge in orang asli community. But I nak just highlight that among 20 yang kita ambil, 19 actually have what you call that, eligible test, means ada DNA, means it's true, but all are negative. So luckily, so syukur all are negative, so we don't need to call them back. But this one, before I dah highlight dengan the FMS in Gua Musang that we will try some of mechanism to bring back the patient to the KK Gua Musang by their pasukan bergerak orang asli, so that we can arrange for the colposcopy if positive, right? But from the pilot project, from the 20 samples, all are negative. So we got 90 eligible. Only one that not eligible means no DNA. Okay, either they put it wrongly or it just tak buat properly. We didn't manage to search back the lady. Okay, so it's quite okay, 19 out of 20. So even counsel patient, even orang asli, I buat dekat orang asli pun boleh buat, alright, by themselves. Kita ada nurse, ada bawa nurse juga as a volunteer. Just prepare to take, but none have problem, so they can do by themselves. Okay, so it's a challenge lah. Takkan you punya patient pergi GP dekat bandar ni cannot do it, alright. Okay, so this is Prof Wu's reflection, that's why she started the ROSE program actually, because apart from result management, so she said you need to remember, or you need to understand, or you need to emphasize on the patient management is more important than the result management. So we are not just treating the result, alright, result ni okay pergi sini, but patient means you need to understand the navigation of the patient. What's her problem getting the result, apa dia punya anxiety when getting the result, apa problem dia in understanding what to do next, alright, nak pergi mana, right, masa dia, okay, semua tu is and I believe in primary care, if you you should be more aware of this, rather than, not to say orang hospital tak buat macam tu, but sometimes we are too overwhelmed with many referrals and managing abnormality. So I think my personal point, actually those in primary care even better, should be better, and even actually they have been better in the implementing patient management than just the result management. Alright, so part of it actually you kena tengok the risk of loss of follow up. That's why I cakap, when you bayang, imagine a patient being referred Oh, kata, oh ni kena buat kolposcopy ni, tapi sebab buat kat GP lah, hospital ni tak nak terima. Hospital ni kena terima daripada KK je. So you kena pergi balik hospital, kena line up balik, beratur balik. Then ada pula hospital, oh okay, syarat hospital ni dia tak boleh terima HPV saja, dia kena buat pap smear dulu. Memang itu that's the ni, itu kekangan from the KKM. But you imagine the patients punya problem. Okay, and then bukannya kata ni, but majority will be normal really. Alright. But imagine you either you miss or you delay the diagnosis of serious things, or the more problematic or the highest problem, the higher problem actually is those yang lost to follow up because of this, bukanlah red tape, this hierarchy lah, this apa tu, administrative punya issue, and all that. Alright. Okay, another thing is, but this is of course KKM might consider this, but they cannot be because of other problem. Okay, they cannot do colposcopy in all HPV, high risk HPV positive. Of course, because they need to calculate the manpower. Okay, they need to calculate the priority. If you do that for all, maybe you may miss or you may delay the diagnosis of importance one. Okay, because I mean, that's the other problem, because even in other disease pun, okay, banyak lagi problem kita. But those who have the facility, you have the affordability, means a patient that can pay, or you have the referral pathway. You need to understand that sometimes the patient actually not doing anything. Bumbang orang cerita pasal HPV, kena buat HPV, tapi cakap bila positif, oh okay, ni tak apa lagi, you repeat balik. Sometimes the patient won't be accepting. Okay, so of course KKM buat triage tu, dia buat pap smear dulu, dos yang positif baru hantar, dos yang pap smear negatif you repeat another 1 year or 6 months or 1 year. Of course, talking about general KKM punya budget, general public punya services, it may be affordable, may be okay, but some patient actually, you think yourself as a patient macam mana. Alright, so that's why we in UPM, for example, talking about UPM and maybe other place that I do, actually we even Prof Wu in accepting all HPV positive. Okay, so without need to do a pap smear first, because we can afford, and we believe that we can help the KKM in their load. All right. Okay, there's another thing. This is for hospital. This is for colposcopists and gynecologists. Talking about ablation now, can be a solution. It's already there. It's not something new. It's already there even in WHO guideline, that recommendation management of CIN. Thermal ablation is almost as effective as as the excision as a treatment of CIN. Okay, another thing is that then this one we go into the next topic, which is vaccination. Actually, especially you are in private setting, in GP for example, the potential benefit of vaccination at the time of treatment, even not to say at the time of treatment, even at the time of screening. Okay, means the patient comes already, you should already either you counsel atau sometimes you pun termis counsel patient sendiri yang I nak cerita pasal I nak dapatkan di screening. You may counsel her even for vaccination if eligible lah. Talking about eligible, janganlah patient yang dah vaksin dulu you ni, ataupun patient at the very old age, then you counsel about vaccination and all that. But those potential patient, all right, you should counsel also for vaccination. You look into that. Okay, but of course, I understand not all GPs have this expensive vaccine like Gardasil 9 readily available all the time. Okay, sometimes need order and all that, but okay, at least, and even order pun at least an opportunity. Okay, review the result. What about you book for the vaccine next time and you review the result, you get the vaccine. The patient akan tanya, habis kalau dah positif one or two DNA type, HPV type, you have Gardasil 9, or you have other type to cover. There's another counseling. Okay, before we go into the vaccination, I think this is one case study, all right, and we incorporated it into one of the module for GP training in as just to illustrate the example of some myth, misunderstanding, etc. 40-year-old lady came to GP requesting for cancer screening. All right, her sister was just recently diagnosed with cervical cancer. All right, last pap smear was during her last pregnancy about 10 years ago. She is anxious about getting another pap smear test. As she said, it was painful. All right, so this is quite common scenario. Alright, so ada banyak benda point dekat sini about the family history. I mean about the sister. Of course, you cakap dengan dia it's not family related, but it's good. You jangan cakap terus tak ada apa-apa ni bukan related. Jangan terus salah. No, it's good that she aware of that because her sister got dan dia tengok the problem of cervical cancer, what's the morbidity that the sister has. Of course, it's good. But slowly you need to explain that actually it's not related. So it's not like, maksudnya nak katakan dia kalau dia ada orang lain kawan yang tak ada family history pun, actually you should screen, you should be screened, okay, because it's not related to familial, alright, rather talking about breast and ovarian cancer like lain, right? So do I still need a test even though I am a loyal to my husband? This is quite common. Satu common untuk orang tanya because they don't do because they see like, I don't have this risk factor. This is important. But we should know that even in single partner, the risk is actually 90% that any woman can get. It's slightly low in male because of the anatomy. Male about 30 to 40 can get HPV anywhere in their lifetime, but women up to 90%. Right? Even in single partner. Right? So that's why you need to educate them. All right? That's why the aim, I mean not to say aim lah, one of the point or tactic is to remove, not to highlight the multiple sexual partner, early onset, whatever, bisexual, to reduce, to remove that to be highlighted. Okay, bukan kita tipu, right? Kita remove to be highlighted because the bigger risk actually not being screened. So we want even in, kalau nak kata in Islam pun dia ada yang apa, kita kena pilih yang less apa tu, akhafud dararain tu, yang less troublesome. So the bigger problem actually not being screened. So we highlight that. Alright, don't highlight the other. So because in highlighting those yang multiple sexual partner lah, blah blah blah, it may cause a problem or may reduce your screening uptake. So we know that. So that's why kita kena ni. Another important things in this related to this single partner ke apa is to counsel them when the result baik. Kalau dia dapat positif, dia start lah. Okay, ni sebab husband saya tak loyal ke, ada promiscuity ke apa. This is another thing. You need to explain that. Alright, even in single partner, okay, you can get HPV anyway in your lifetime. Okay. The difference is whether you get the persistent infection or the body get cleared straight away. Right? Is it familial? Kita dah cover. It's not. Can I have a blood test as an alternative? Ni quite common juga in GP kan, macam kan, nak ambil tumor marker boleh tak? Saya nak tahu untuk semua cancer. Okay lah untuk ovarian, but it's not specific juga, sama je. Alright, so you need to counsel, you need to have your clinical understanding first in order for you to counsel the patient. It's not specific. Alright, and even if blood test in cervical lagi senang, cervical lagi lah tak ada terus, nothing blood test related to that. So even senang, and the test is very easy. Test is just swab. Alright. Okay, do I need vaccination is another point. Some myth, cervical screening is only for patient having symptoms. It's very important to overcome this misunderstanding. Alright, jangan ingat tak ada apa-apa ni. Screening adalah untuk yang normal. Alright, kalau patient dah ada symptom, dah ada bleeding, it's not screening. We need to investigate. Okay. It's only for those with risk factor. Ini pun saya dah highlight. Dan kita terlupa actually the biggest risk factor, which is the biggest risk factor is not being screened. Saya ulang balik ayat tu. Alright. Pap smear is adequate to exclude cervical cancer. It's very important to or even CIN. Okay, Pap smear, the sensitivity is not that high, so you need the repeated test. Alright, and now HPV DNA is even better. Alright. If a patient has positive screening result, means she has cancer. I dah highlight juga sebelum ni. This is common misunderstanding. It may be one of the reason or barrier for a patient to continue the journey. Alright, the patient may stop because of this. Dia tak nak tahu. Ada juga patient kita pelik-pelik juga kan, tak nak tahu. Ada cancer tak ada apa, tapi saya tak nak tahu ada cancer. So this is another problem jugalah. Alright.